My name is Justin Love. I'm a dermatology PA. I've been practicing for 18 years. I see it continuing to evolving and just, kind of playing nice in the sandbox, you know what I mean? I don't know I know there are times when it's had to kind of forcefully evolve a little bit, but I think the more open we are to kind of asking each other for kind of help, for referrals, for reaching out, I see that the more we communicate, the better acquainted we get. I work with a multitude of NPs and physicians and a bunch of other specialties, and there are times where after a while, I've never met these people in person, but we communicate via electronic medical record. And after a while, we become kind of on a first referral to referral basis. So if, for example, if a rheumatologist or an oncologist needs to get a patient in for something, they just kind of message me directly because they know I'm kind of that access point. I've been able to be that access point for dermatologic care. And I do my best to try to, get them in. But I think people just have to be open and willing to just kind of like extend those branches of communication. Realize that we're kind of all in this together, and it's about taking care of the entire patient, not just about like what I do and you do, and you stay over here and I'll stay over here. At some point, they're all going to cross over and link, because you never know, what specialists you might need to kind of help you out with a particular tough case. One trend that I'm interested in is the aspect of disease modification. With so many different inflammatory disease states, do we have the ability to incorporate medicines earlier on in the inflammatory process to kind of modify that as patients get older and as they kind of deal with it? I think that's what I'm probably most excited to see, is to see how early intervention with our advanced, biologics and small molecules, and does that kind of impact a patient's longevity as they get older, as they deal with some of the chronicity of some of these diseases. I'm hopeful for medicines that don't need as much monitoring, medicines that hurt less, medicines that don't have as much side effects, medicines that can kind of hope to achieve, what patients, need, as far as whether it's repigmentation of vitiligo or helping with their joint disease and psoriatic disease process, whether it's helping with their atopic dermatitis, again, things that can, hopefully achieve, complete itch reduction and skin clearance. We have medicines that kind of sometimes they do one really, really well, and the other kind of, wanes a little bit, but that's what I'm excited about, is some of the newer things coming out that are really fascinating, that are much, much safer than what we used to have. I know there's a generation of derm PAs and NPs that will never have to really utilize like cyclosporin and methotrexate, and I think that's a great thing. Not to say that they don't have their place at some point in time, but they won't have to kind of experience that as a provider, but the patient won't also have to experience that too, which I think is a huge, huge benefit. No, I'm just grateful for the opportunity. I love dermatology. It's been wonderful. It's been a fantastic career. I'm just happy to be a part of the process, and appreciate you guys coming out and talking about it with me.